I'm Dr. Reetesh Sharma, Director and Head, Nephrology and Kidney Transplant Medicine, Asian Institute of Medical Sciences, Faridabad, Delhi. I shall be talking about chronic kidney disease and its treatment. Chronic kidney disease stage 5 is a condition where the kidneys have failed irreversibly, and this usually progresses over a period of months to years. The patients usually present with progressive loss of appetite, weight, weakness, gradually worsening swelling all over the body, and breathing difficulty. Diabetes and high blood pressure are the commonest causes of kidney failure worldwide. Once the patients reach the end stage of kidney disease, there are two modalities of treatment, one being dialysis and the other is transplantation. If picked up early, we can initiate treatment which can slow down the progression of disease, but once irreversible permanent kidney failure happens, we need to start the patient on dialysis or transplant as a life-saving modality. Dialysis is usually done 3 times a week, and for a layman it is basically cleansing the blood of all the toxins which accumulate in the body. Our kidneys normally function to throw away the toxins generated every day, including the extra water. And once they fail and these toxins accumulate, the patients start falling sick. So purification of blood is done 4 hours each session, and it is done 3 times of a week. A better treatment for kidney failure is a kidney transplantation, wherein one healthy person with 2 healthy kidneys can donate one of his kidneys to his near and dear ones. And after receiving a kidney from a healthy person, this patient can lead a normal life. The process of transplant begins by doing complete workup. Medically, fitness has to be determined both for the patient as well as the kidney donor. Generally, they have to be blood group matched. However, nowadays we are also doing blood group mismatched or incompatible transplant with equally good success rates. Once the medical evaluation is done and we find that the patient and the kidney donor are completely healthy, we take them up for a kidney transplant. This usually is a process which requires about a week or 10 days of admission, and after that the person is discharged just like any other normal person. However, he needs to take certain medicines lifelong so that this kidney is accepted by the body, because our immune system realizes that this kidney does not belong to our body. If one has to compare the modality which is better, kidney transplant is better than dialysis in most of the respects, and usually it remains the treatment of choice for all kidney failure patients. When we look at the quality of health, a patient on transplant fares better than somebody who is on dialysis. The quality of life is better because apart from taking a few medicines, he leads a normal life like any other person. Small children who have undergone transplant have gone back to school, completed their schooling, gone to college and taken up jobs. Similarly, patients who are doing a job can resume their duties within 2 to 3 months after a transplant like any other normal person. People can have children after a successful transplantation. All this is difficult when somebody is on dialysis. When we look at the survival benefits, the 10-year survivals on dialysis versus that of transplant, there is a lot of difference. If we see 100 patients who are on dialysis now, at the end of 10 years, only about 15 to 20 will survive, whereas on transplantation, the survivals are 75 to 80%. When we compare the cost of therapy, transplant works out cheaper than dialysis if we look at the yearly cost of treatment, anywhere between 30 to 50% of the cost of dialysis. And in fact, if we pick up the patients early, instead of putting them on dialysis, we would offer them a kidney transplant, which gives the best health benefits. This is what is termed as a preemptive transplant, which is transplant done before the need of dialysis arises. So on the whole, for a patients of kidney failure, we would recommend kidney transplant as the best therapy. It is also the most cost-effective therapy. We at Asian Institute are regularly doing kidney transplants of all natures, including the blood group mismatch transplants with equally good success rates, and our outcomes are at par with the best centers in the world.